for the support that Bupa have been providing to WorkSafe Tasmania. And it's been very tangible support. It's not only been in bringing speakers over, but also in financially supporting the work that is being done through WorkSafe Tasmania, and also through the partnership that the Tasmanian government has with the Commonwealth government in delivering healthier workplaces in Tasmania. So we're now going to hear from Katrina Walton, who is Bupa's Workplace Health Management Consultant. And Bob, who went to Bob's sessions? How many of you went along to Bob's sessions? Yeah, well, Bob told me just a moment ago that isn't it great when you come along and you have somebody who, he tells me, Katrina, you trained with him when you did your human movement studies quite some time ago.
That ages me.
But what I think is interesting about that, and I was also just chatting to Katrina, and she also has a Masters of Public Health. And that's a qualification, I think, that we're trying to build more capacity in Tasmania around public health more broadly. And that goes back to my comments at the beginning of this meeting when we talk about the causes behind the causes of poor health outcomes in Tasmania. And people with public health training actually look really outside the square. They look at the system as a whole. So they look, in Tasmania, for example, they look at how health and wellbeing outcomes in Tasmania plug into the national and into the international body of evidence, not just about human movement, which is Katrina's original qualification, but look more broadly at the whole of the system and look at not just risk factors, but look at all of the interplay of things into that. So I'm really looking forward to Katrina's presentation, because it obviously informs all of the work that Bupa do around workplaces, but also, more importantly, what Bupa does in health and wellbeing generally for all of the people that are associated with Bupa. So Katrina has been 17 years, Bob, experience, it says here. So we can probably add a little bit more to that for the time at university and so on, and do some deduction about how old perhaps you and I might both be. But she's had 17 years experience in the development and implementation of award-winning workplace wellness programs for small to large organisations, and both nationally and internationally. So she has that perspective that's not just small business, it's big business, but it's also drawing on the best from overseas. She's had extensive experience in the development of broader human capital solutions, so not just around workplace, but looking at the value of human capital more generally. And she's a sought-after speaker and writer, having presented throughout Australia, Europe and the United Kingdom, and regularly presents both to academics at universities but at state and national forums. In her current role as Workplace Health Management Consultant for Bupa Australia, she supports employers to find a healthier workforce through innovative, targeted and integrated workplace health and wellbeing strategies. So I'm really looking forward, Katrina, to your presentation.
Thank you. And thank you. And thank you very much for the lovely introduction. It's great to be in beautiful Launceston this morning. I thought I would set the scene with a bit of a scenario this morning that may resonate with a few of you in the room. So you're busy getting the kids for school and you get the call. Your mum's had a fall, she's in the emergency department, your dad's in a panic and he wants you to come home straight away, albeit a 3-hour drive. To top it all off, you've got a major presentation to give to your biggest client that morning. And needless to say, you're going to be missing your weekly yoga class again that afternoon. So you're worried about your mum, your dad, your kids, your boss, your declining health and wellness. Herein lies our sandwich generation within our workforces. This sandwich generation, as it's coined, is often employees in our workforce who are grappling with raising children, but at the same time, increasing dependent parents as well. And also many who are in their midlife, also potentially having grandchildren and providing support across those different generations. So this is the compound effect of a few factors. Our baby boomers are reaching age 65. We're seeing increased life expectancy and also declining fertility rates. So for many of those that are in this sandwich, so to speak, from a health and wellness point of view, is putting extra physical demands on them. A lot of them are emotionally drained and potentially socially isolated as a result as well. And all this puts a lot of additional stress on these individuals. So investing in the health and wellness of our sandwich generation, but also our broader workforce demographic, is going to have benefits not just for those employees within our workforce, but also for the organisations and many businesses in this room. So for the organisation, what are the benefits? Well, it will enable us to reduce the cost of absenteeism, presenteeism, workers' compensation costs in our organisation. It will enable us to maintain a safe and healthy workforce, and it will enable us to improve workplace morale, engagement, and ultimately organisational performance. Now, you might work in organisations where senior leaders view wellness as a bit of a nice to have or a bit of fluff. And there might even be some in this room here today who think that as well. Whereas in fact, research tells us, and certainly my experience has been, that for every dollar invested results in a $3 to $6 return. Now, there's not many workplace initiatives that can make that claim. And this is why 96% of best practice organisations in Australia have implemented such programs. And this is why, even in tighter economic times, which we are certainly seeing, I know in Queensland particularly at the moment, those progressive organisations in which we're working, or those progressive clients, realise it's even more important then to have healthy, resilient and high-performing employees to see them through such periods and beyond. So, as mentioned, I've worked in this field for a while now, 17 years, delivering multi-award winning programs across a range of industries. And a large percentage of that time has been managing in-house, large-scale and national programs. What that has probably given me is a really good sense on the ground of some of the challenges a lot of you today will be facing in this room, in not only developing such programs, but most importantly, sustaining them, and really how to demonstrate that value on that investment. So what I'm going to endeavour to do today is really look at how to develop a best practice program for your organisation, one that really, yes, supports that sandwich generation, but also will benefit the broader workforce as well. So why a healthier workforce? So we've spoken already a bit this morning, and Louise had a great session delving into some of the ageing population considerations. And we do know that Tasmania has the most ageing population across the states and territories within Australia. The median age of the Australian population has increased by 4.8 years over the last 2 decades, and as touched on already, that's a result of sustained low fertility and increasing life expectancy. Children in that 0 to 14 year age bracket make up nearly 20% of our population today, and people aged 65 years and over are around 15% of the population. So that's really created this sandwich effect where we've got that dual dependency and sometimes triple dependency across the generations. And we're seeing that mirrored within our workforce as well. Australia has the most rapidly ageing workforce in the world. So 34% of Australians aged 55 years are in the workforce, which has been an increase from 25% over the last 30 years, which makes up 16% of the total labour force today, which again has increased from 10% 3 decades earlier, a lot of that which has happened in the most recent decade. And this has significant implications for business from a transition to retirement standpoint, from a knowledge retention and capture point of view, from a financial wellness point of view, from a flexible working arrangements point of view, and also from a health risk standpoint as well. And what I find interesting is 56% of Australian organisations believe that an ageing workforce will have a strong or significant impact on their business, but many have been very slow to act. And you see a wealth of research on this topic within Australia and literature acknowledging, yes, we have an ageing workforce. But what I find particularly interesting from a health point of view, particularly when it delves into some of the productivity dimensions as part of that, there's basically no mention of health-related impacts at all. So we're going to touch on some of those today. And a bit of food for thought, just some additional Australian-related stats. The average age at which Australian workers are intending to retire is 63. 41% of those intend to transition into part-time work before they retire, the large bulk of which will stay with you to do that. 1 in 4 baby boomers expect to delay retirements until their 70s. 13% never want to retire. think my dad's in that category. He'll work till he drops. Encouragingly, 2.4 times, those that are 45 years and over within your organisations are nearly 2.5 times more likely to stay with you as an employer, which highlights why it's even more important to be investing in the health, wellness, training, of your mature workforce. They're the ones that are likely to be with you for the longer term. And 61% of Australian employees believe that wellbeing significantly impacts their retirement planning decision, in addition to things such as job satisfaction, financial security, having a supportive work environment. So as you can see from even some of those dimensions, managing an ageing workforce is more than just having flexible working arrangements and having a retirement planning seminar. It's a lot more complex than that. So what are some of the other key drivers as to why Australian organisations are investing in the health and wellness of their people? There was a large global study that was done by a group called Bupa Consultants, and they looked at globally and also within Australia, what are the reasons that organisations are investing in the health and wellness of their people? And what they found is number one was safety, because to quote Dame Carol Black, it's hard to be a safe worker if you're not a healthy worker. Number two was absenteeism. And there's a lot of research and evidence to show the impact of health and wellbeing interventions on absenteeism, sickness-related absenteeism. There's a very famous study that was done by a leading researcher and academic called Larry Chapman, a large, what we call meta-analyses, where he reviewed best practice programs globally. And what he found for programs that have been going for at least 3 years, there was an average reduction in absenteeism of 25%. So there's certainly some benefits to be had there. And the third one is productivity. And when we look at some of the potential health risks that are inherent within your workplace, 6 in 10 Australian adults do not meet the recommended physical activity guidelines. 8 in 10 of us will have chronic back pain at some point in our lifetime. 1 in 6 of us will experience depression. And I'm finding this is an area that's really resonating and getting a lot more attention within organisations, considering that 1 in 2 of us will have a mental health issue within our lifetime, and 1 in 5 of us will on an annual basis within our workplace. So that's 20% of your workplace that are grappling with a mental health issue each year, that are going to be impacting on things like your absenteeism, your presenteeism, so employees are coming to work, but due to a health or medical reason, they're not performing at their optimum. I was at the Miners Health and Wellbeing Conference in Brisbane recently presenting there, and it was interesting listening to one of the speakers, and they were saying with the fly-in, fly-out workers and some of the mental health pressures inherent in that type of work, and that's actually 1 in 3 that suffer with a mental health issue in that fly-in, fly-out workforce. And the concerning trends and the increase in suicide as well within that demographic. And when you look at the cost of depression alone for the workplace, the average cost of untreated depression for an Australian worker equates to about $10,000 per year. So mental health is certainly resonating with a lot of organisations, particularly linked to the recent OHS harmonisation as well. And you can see there things like heart disease, 1 in 6 are affected by heart disease, overweight and obesity being another one that has real flow-ons again to the workplace. So we know that those workers who are overweight or obese are at an increased likelihood of being injured. When they do get injured, it takes longer for them to recover, have high rates of absenteeism, etc. In addition to that, 96% of us, so 96% of us potentially in this room, have at least one modifiable risk factor for chronic disease. So whether it be high blood pressure, high cholesterol, overweight or obesity, etc. And I think what is quite frightening as a statistic, 75% have multiple. So again, probably 3/4 of this room potentially have multiple risk factors. Now there was a large Australian study that was done that looked at healthy employees within Australia who had 2 health risk factors or less versus unhealthy employees who had 5 health risk factors or more. And what they found is the healthy employees were 3 times more productive and had 9 times less sick leave than the unhealthy employees. Which really begs the question for your organisation, how much is poor health and wellness costing your organisation? Do you know? And when we look at the average number of national health priority conditions, this is from 2004-05, some of the more recent stats. So that includes things like arthritis, osteoporosis, asthma, cancer, cardiovascular disease, diabetes, injury, mental health and obesity. Unsurprisingly, the number of those conditions, which is on the vertical axis there, does increase as we get older, which has a flow on again to the workplace. And we're starting to see that in some of the statistics now. Workers' compensation claims in 2004-05 were for employees greater than 45 years, 39% of claims, which has shifted from 33% in 1997. So we are starting to see a shift there. And as further food for thought, 21.8% of Australians with chronic disease claim their conditions are work-related. So again, it comes back to that sense of shared responsibility within the workplace. It was interesting too, just looking at some of the latest stats from the ABS, and they were comparing data for baby boomers aged 53 to 62 years in 2007-08 to the same generational group in 1989 in 90s, who are now 71 and 80 years, if that makes sense. And they show that the rates of obesity, asthma, hearing loss and high cholesterol for baby boomers are double those of the previous generation. The diabetes rate has tripled, and the proportion of this age group with chronic disease to manage is substantially higher. So again, this is potentially going to have flow-ons to the workplace. But what is interesting is that the mature ages within your workplace may not be the high-risk ones. And this was a very well-known study done by a leading academic and researcher called Shirley Musich, who specialises in the area of health and productivity. And remember we spoke about that term presenteeism earlier? So that's as opposed to absenteeism where people are away from work. Presenteeism was when people are coming to work, but due to a health or medical reason they're not performing at their optimum. So they could be suffering with chronic back problem or headaches or migraines or mental health conditions. And interestingly, what she found is for health-related work impairment, it was actually higher for the younger populations. And when she broke it down further, when she looked at those that are in the good health bracket, so having 2 health risk factors or less, the productivity levels were still higher for the more mature workforce. And even when she broke it down further, looking at high-risk individuals, again, the older demographic was still more productive within the workplace. And she attributed this to a number of reasons. One of them is that sometimes in the younger populations they tend to have high-risk behaviours, so high rates of alcohol and binge drinking, etc. So that was certainly one of the reasons. But the other reason that was discussed in that paper was some of the attitudes and commitment and loyalty of some of the older demographic and sort of push on through potentially some health-related impediments. One of the other key drivers for Australian organisations, and this is something, actually I might just go back to that point. One thing I meant to comment there is I guess it just highlights the importance of really supporting the health and well-being of your employees across the different generations. So looking at an age-friendly strategy and keeping the healthy employees healthy no matter what age, so that any potential age-related impacts, can be offset. So to one of the other key drivers that came out of this global healthy workforce study, both within Australia and internationally, was employee engagement as another key driver for organisations in investing in the health and wellness of their people. And there was a study that was done by Right Management that's quoted up on the screen here, and what they found is in those organisations where health and wellness is managed well, the employees in those organisations were nearly 8 times more engaged in those organisations. And I've really seen this in practice. I was previously National Wellness Manager of a large healthcare provider, of which we had 25,000 employees. And we actually looked at this analysis. We looked at those sites, those hospitals that had adopted the health and wellness program, and we looked at how that correlated to staff satisfaction, of which there was a beautiful, perfect correlation. So where there were healthy staff, they were also very happy and satisfied staff. And then we took it a step further to patient satisfaction. And again, unsurprisingly, we saw a very positive correlation between those 3 dimensions. And on the flip side, we saw the opposite. So those hospitals that hadn't gone down the wellness road and probably general people management strategies more broadly, again had lower satisfaction and lower patient scores. And I think we saw a great example of that this morning in the case study as well, where it was having those broader flow-on benefits to the residents. There was another study that was done by Watson as well, and it looked at all the different factors or engagement factors that attract, retain, and I guess engage your employees and connect your employees with a workplace. And they looked at a lot of the typical dimensions you would expect, like career opportunities and management style and workload and things. And what they found is health and wellbeing was the number one driver for employee engagement within your workplace. So certainly this is, I find with a lot of our clients, yes, there are some, I guess, more direct or harder outcomes they're looking for, but also sometimes it's about being an employer of choice and being a fun and positive environment in which to work. So why invest in your workforce? So there's a number of stakeholders that really have a vested interest in having healthy employees at work. So we've spoken a lot about the employer, there's a lot of benefits for them. Obviously at a government level we spend a third of our life at work. For many of us we'd probably like to spend a little less. But certainly it's a really important setting for preventative health and has been identified by the federal government with the Healthy Worker Initiative for that reason. So whilst work can have a very positive effect on our wellbeing through rewarding, stimulating and challenging work, it can have the very opposite effect as well. So a very important setting for preventative health. And obviously the employee, what's in it for them? Access to on-site, convenient, subsidised programs, often that have flow-on benefits to their family as well. So it really is a win-win scenario. And there is a real, tangible return on investment as well. And I think it's really, I've certainly seen the 17 years that I've been involved in the industry, a real shift from that perception of being a nice to have and a bit of fluff to now being a real business imperative for organisations. And there's some benefits that come, as we've got on here, things like improved wellness through non-illness related personal leave, having staff fit for work both physically and mentally, providing again a supportive environment for employees to work, productivity we've touched on already, risk management, an increase in staff attendance, both in an absenteeism and presenteeism sense. But I think what's important with this, just to put this in perspective, I'll just show you on the next. No, I've turned off the wrong one. So I guess in embarking on this wellness journey is making sure you're really managing the expectations too of some of those key decision makers and senior leaders as to what's realistic around some of these outcomes. So certainly if you look at participation along the bottom and return on investment along the vertical axis here, this is drawn from some work that again Larry Chapman has done from the US. And what he looks at as when a program, I guess, particularly starts, often you'll see probably a spike at about that 70% participation mark from an ROI point of view, where it really starts to kick in. And there's a number of reasons that he attributes to that. So the more people you draw into the program, particularly at 70% mark, there's quite a sharp spike in return on investment. Did anyone hesitate to guess as to why that might be?
Pressure?
Sorry, where did that voice come from? Sorry?
Peer group pressure?
Yes, so somewhere around that peer support, yeah. Probably rather than pressure, peer support, yeah, certainly. And about building sometimes that culture that comes with it as well. Any other thoughts? Yes?
Is it maybe that at that 70% you start picking up people who are perhaps less engaged or more at risk? And like
Exactly.
the first people who come on board are the really super excited
Yes.
ones that are already healthy?
Perfect answer, thank you. Explained beautifully. So yeah, so that's, as you said, often you get more the wellness inclined who originally engage with your program, as you say, who may not be the high risk individuals you're really needing to tap into. And I saw this mirrored perfectly when I was working at Adidas in the UK. They had a very distinct white and blue collar workforce. The white collar were the sales workforce, the blue collar were the warehouse employees, and we had a beautiful state-of-the-art wellness centre there with all the bells and whistles. The sales guys were knocking on the door the minute it opened, were engaged and involved, very competitive bunch. Whereas it took us probably that 2 to 3 years to really get the engagement from the warehouse, and physically going onto the warehouse floor with our blood pressure cuffs and our cholesterol, and building that trust and rapport as well as part of it as well. Because I was sceptical as to why do you want to know my alcohol intake and my physical dimensions. So So the other important point as well, not to say that early on, if you're looking at this even as a timeline of a program, you know, in the first 12 months of a program, you're going to see some benefits, yes, and things like morale and team building, etc. But it's really that 3 to 5 year mark that you're going to start to see some of these more hard-hitting impacts and outcomes with your program. So the reason I say that, it's important, I think, up front when you're trying to potentially sell in or demonstrate the business case for such programs to your senior management, it's not going to happen overnight. It's not going to be a 12-month fix. We really need to be looking at this as an investment in the health and wellness of our people. And again, this is based on some further research that shows a $6 return for every dollar invested as well. I think while some of the ROI data is important, I'd probably also say I prefer the term value on investment. Yes, there's a lot of direct benefits that come from such programs, but sometimes there are a lot of other softer benefits that sometimes are a bit harder to quantify that are just as important for organisations in going down the wellness road. So I know when we started the program in this healthcare organisation, it was about being an employer of choice for them. They couldn't compete with the not-for-profit hospital down the road on salary. They were wanting to compete on benefits and really being a good place to work. So that was their key driver. So linked to that, we developed some metrics around that were meaningful for them. And then as the program evolved, yes, there were some other great benefits that came around that 3 to 5 year mark with improvements in things like their workers' compensation costs, reductions in injuries, etc. But for them, it wasn't really why, I guess, the key purpose for why they were doing what they were doing. So how do we help you find a healthier workforce? So I guess to answer this, we also need to look at the changing workplace as well within Australia. So if we look back to the 1960s, the typical, I guess, working day was Monday to Friday, 9 to 5. Whereas today we see a whole diversity of working arrangements, whether it be fly in, fly out, and we see a lot more part-time, casual arrangements, largely due to the increase in female participation within the workforce. 71% of Australians now work from home at some point each year. So it might be while they've got a child home sick or a more formal arrangement. Australians are working harder and longer. The average Australian works 70 minutes of unpaid overtime per day. 70 minutes. So that equates to an additional 6.5 weeks of annual leave per year. So we're seeing, I guess some of these considerations present challenges for wellness delivery. In the 1960s, you know, smoking was able in the workplace. I remember being mortified going over to work for Adidas, and in their German office they could still smoke. And coming from Australia, that, you know, how you could work and with someone smoking beside you productively was, yeah. So I think we've come a long way. So we have the benefit now of nice clean air where we work. Also, the average tenure back in 1960s was 15 years, whereas the average Australian employee now works for 4 years with an organisation. I heard an interesting stat recently where they're saying the average school leaver today will have 5 careers, will work for 20 different employers, and will work for themselves at least once. So it really is a changing workplace in which we're working. And the shift in blue collar as well. So in the 1960s it was about 55% blue collar, now it's 30% today. So a lot of considerations from a wellbeing point of view, but also from a wellness delivery point of view. So I guess a healthy organisation recognises all the different dimensions or determinants of health and wellbeing within the workplace. So it acknowledges both the physical and psychological dimensions, but also acknowledges the personal or individual dimensions and also at an environmental level. So this is a work health radar that has been developed by Bupa, and it's one of the diagnostics tools that are used as part of the consultancy piece. And you can see there's various dimensions there that the tool delves into. So healthier bodies being all the physical well-being, healthier minds being obviously the important area of mental health, healthy cultures within the workplace, so how things are done around here, and the healthier places as well, so concentrating on making those healthy choices, the easy choices. So the benefit of this model, I guess, is a lot of, certainly programs that I see within workplaces, and I think the way the corporate health industry still approaches a lot of its work, it's very much centred on the right side of that circle, very much on the individual and the onus on them. But I think as the lines between work and life are blurring more and more, as we saw in that previous slide, it's even more important that we adopt an integrated approach to addressing the area of health and wellbeing within the workplace. And what research also shows us within Australia is that programs that take that integrated approach are much more likely to have high participation rates, they're much more likely to positively impact health behaviours, and they're also much more likely to prevent chronic disease. Because to quote one of my favourite sayings, massages on Mondays don't make up for boring work, lousy leadership, and no career opportunities. So if you're not addressing some of the deeper seated wellness issues within your workplace, it's only going to ever be perceived as a band-aid. And I've seen it backfire badly. So there's no point offering a stress buster seminar if you're not addressing some of the deeper psychosocial issues within that workplace. So just to delve into some of these dimensions a bit further. So we have the important area of physical well-being. So this looks at things such as lifestyle factors, the medical profile of the individual, and from a health management point of view. So whilst certainly physical capacity without intervention can decline with age, and that might have implications particularly for employees that are in heavier physical based roles, certainly through focusing on the physical well-being can certainly improve and extend the workability for those individuals. The area of mental well-being as well we spoke about earlier about some of the additional stresses and strains, particularly on that sandwich generation. And we spoke about the growing recognition and importance of focusing on mental health, not only of individuals but also within the workplace. So this really delves into further the areas of stress management, personal resilience and healthy behaviours. We've also spoken, I know a lot in Bob's sessions that he's been running in recent days around some of the important cultural dimensions, including healthy leadership. And that's important for two reasons. Firstly, our leaders need to be well to lead well. So to be effective, resilient and high-performing leaders, health and wellness really is the core foundation of that. Otherwise it's not sustainable. I don't know about you, but I've observed a lot of leaders who have neglected their well-being. It's almost like a car crash, isn't it, waiting to happen? So it's certainly important in that respect, and I think, and also having worked with a lot of CEOs over the years as well, there's that saying, that a lot of senior managers, sacrifice their health to gain wealth, and then spend their wealth to regain their health, and you see that a lot in practice. So it's important for them individually, but also it's important for them to be active and visible leaders around wellness as well. Because in essence, it's the make or break, isn't it, of a successful program, as we all know. Social support as well, so that can include things such as peer support and mentoring, and we touched on that as a dimension a bit earlier. And health benefits as well that you can provide as an organisation. So that can include things like corporate health insurance for employees. I'm seeing an increasing number of organisations provide support in the area of elder care, like elder care referral programs and the like. It's interesting with elder care, that is shouldered a lot in our peak working years of 35 to 55 years, and a lot of that burden is taken on by females as well, which can mean them sometimes scaling back hours and looking at maybe more flexible work options or the like. Also the area of work-life balance too is an important one. So providing again flexible working policies and the like to give, I guess in that day-to-day to not just informal arrangements. And financial wellness we've touched on a bit, and I know in Louise's session we delved into the important areas of financial wellness. Because I think again for that sandwich generation what we're seeing is they're having not just emotional support and physical support they're needing to provide, but also financial support across multiple generations as well. And particularly for a lot of our mature age female employees who may have been out of the workforce for a time with child-rearing responsibilities. The reality is a lot of them have very low super balances, may not have the savings. I've got a lot of family members in that situation who will be working through to their, to their 70s. For that reason. We've also seen, I guess, the impact of the GFC and people having to delay retirement as well on the back of that. So financial wellness, I think, is a really overlooked and really important dimension of a holistic wellness program. And then we see the area of healthy places as well. So again, it's making those healthy choices the easy choices. And I think there's recognition that our bodies do alter as we age. However, if we can be acknowledging of some of those changes and we can make adjustments and modifications to that provide a safe workplace, not just for our mature workforce, but for all our workforce. And I know there's a great guide that I think was on your desk that have been developed by Better Work Tasmania. I think that is one of the best guides I've seen as far as looking at some of the health and wellness considerations linked to a mature age workforce and some suggestions on how to address that. So as far as looking at a strategy within your workplace, I guess the question is no longer how or why, but how you will go about it. And I guess the stages that I'm going to go through now also mirror quite closely the other great guide that's been developed by WorkSafe and WorkCover, the Workplace Health and Wellbeing Guide. So a lot of the core principles will be the same. So firstly, it's assessing what are the needs, the priorities within your workforce. And ideally marrying those with what are the interests as well of your employee population. That's sometimes where there's a bit of the art and the science that come together. And most importantly, how does that align with the broader organisational vision, direction, etc. So that can be done through a variety of means depending on the size of your organisation. That could be through things like an online health risk assessment, which will give you a good sense of what the inherent health risks are of your population and what that means for you as an organisation. It can be things like focus groups, so having a focus group with cross-section of your management population, a cross-section of your frontline employees, getting a sense from their viewpoints what they feel are the health and wellness needs and priorities, and also importantly the expectations of the program as well. So that's a very effective strategy. It can also include things like an environmental audit. So looking at things like, is there a supportive environment in place? So it's all well and good having a nutrition seminar, but have you got healthy choices available in your vending machines, or are you serving up the same pastries at your team meetings, etc. So that can look at some of the supportive infrastructure surrounding that as well. And then we use the radar tool, which I showed you earlier, which I'll also show you in some additional slides, which provides a bit of a gap analysis across those different 4 dimensions and subsequently where some of those opportunities lie. So from there, designing a targeted program. So whilst it might seem obvious, having a well-established plan that's developed in consultation with key stakeholders within your business, that also most importantly has some very clear metrics aligned with that as well. So what might come out of that? And again, I know we've touched on this a bit earlier about making sure I think Louise touched on it actually, around making sure that where you're spending your dollars is best spent. So getting that best bang for your buck. So you might have a series of core programs that come out of that needs assessment process that are available to all your workforce. So an example of that might be, an employee assistance program or an online health assessment, so something that's available to all employees. Then you might have more targeted strategies. So the other things that can come out of the needs assessment is also special needs of particular groups within your organisation. So that might be at a site level that you've identified they've got different needs, interests, priorities. Or it could be the sandwich generation, as an example. You've identified different things for them. So you might develop some targeted strategies for that group. And then you might have more local-based strategies, potentially, often this is at a site level. So often these are the types of the programs, where you have got a limited budget, that you're best spending your dollars. And then, the targeted strategies might be things, funded maybe at a department level or division based on their particular needs. So they take a bit more ownership around that as well. And then the local needs, often they might be things, as an example, like an on-site, a lunchtime walking group or an on-site yoga class that might be subsidised by the organisation, but employees are contributing to, because that's something of a particular need to that group. So again, making sure it's very targeted with that, and also, as has again been highlighted already this morning, making sure it integrates with and aligns to other things that are already happening within the organisation. So again, as part of that needs assessment piece, really looking at what things are already in place. And with a lot of clients, that's where I spend a lot of my time, where there's a lot of activities happening, but often when you ask them, what impact has that had, they can't quite tell you. So it's shifting a bit from being activity orientated to being more results orientated, looking at align related things within the organisation into a comprehensive and targeted strategy. So then obviously that important implementation stage, and we saw again some great examples this morning of having things like champions and ambassadors again within your organisation to help drive those programs locally. So looking at engagement, ongoing refinement, continuous improvement as part of that, ideally having the official launch as well as part of that program rollout. And then the evaluation. So, I mean, you can't manage what you can't measure. And to get rid of that nice to have tag, you really need to be able to demonstrate the impact of your wellness efforts. And as mentioned, that's often for a lot of organisations involving a shift from that activity orientation to being more results orientated. So really more quality rather than quantity. So doing a few things, doing them well, as part of that initial planning and design phase, being very clear what the outcomes are going to be for your program and how that's going to be measured. And these are just examples of some of the tools that we use within Bupa as part of that needs assessment. So the online health assessment actually does look at things such as age relative to chronic disease risk and health risk status, so it can give you a good sense of where some of those health risks lie. And then it comes with a nice aggregated report also for the organisation, which is de-identified to help drive those wellness efforts as well. And this is just a quick snapshot of the Work Health Radar. So essentially that's done with a cross-section of employees rather than the full population, say like an online health assessment. And it's done with a cross-section of management versus a cross-section of frontline employees. And then you can see where some of those actual gaps and opportunities then lie. So where there's then, so you can again make sure you're getting the best spend for your wellness dollars. And that then enables targeted strategies based on some of those dimensions that are then identified. So for example, in things like healthier places, that could include interventions such as ergonomic assessments, pre-employments or functional assessments, chronic health coaching, etc. So I guess to wrap up, how am I going for time? It's been a real pleasure speaking with you today and essentially outlining how when you put the right thing with the smart thing, it's going to equal the wise thing for your organisation, and how through adopting a strategic approach to your wellness efforts, so one that focuses not just on the sandwich generation but your broader workforce needs, will result in a significant bang for your wellness buck. And that can be simply undertaken through some of the 4 steps that we've outlined today. So as far as, Bupa, we'd certainly be happy to chat to you regarding any ongoing support that we could provide to help make your wellness vision a reality. I have my colleagues Peter here today and Vicky, who'll be available also after the session. So essentially, for those that may not be aware, Bupa provides support, a continuum of care across the area of private health insurance, the workplace health consultancy piece that provides strategic consultancy to really help organisations identify what those true health and wellness needs are, to enable them to ensure that where they are spending their dollars are best spent. And the Bupa Wellness is the service delivery arm, which was previously known as Peak Health. So through that consultancy piece, if there are things that then identified, they can be delivered either externally or through groups such as Bupa Wellness. So I guess in summary, investing in the health and wellness of your organisation will lead to healthy, resilient and high-performing employees and workplace into the future. And I guess you've got to weigh that up against the cost of doing nothing. So hopefully I've convinced you today as to the benefits and that it really is a win-win for both employees and the organisation. Thank you.